am Dr. Surendra, pediatric intensivist, Native Women and Children Hospital, Bangalore. Today I am here to talk about adenovirus infection. Currently there is epidemic of adenovirus infection across India. Even in Bangalore, the epidemic is going on for last 2 months. What is adenovirus infection? What are the symptoms? What are the treatment and how to prevent it? The adenovirus, it is named because it is isolated from the human beings from adenoids. That is why it is labeled as adenovirus. The symptoms of adenovirus are fever, cold, cough, eye discharge, myalgia, vomiting, loose motion. It affects mostly the less than 5 years old kid, or it affects more than 60 years of old persons. Who are at high risk, I've already told. And most of the time, 80 to 90% of the time, it is very mild symptom. It gets better on their bone. 5 to 10% of the patient, they become very sick. It can cause pneumonia. It can cause dehydration by vomiting and loose motion, or they can run high grade fever like 103, 104, 105. So where they need admission with symptomatic treatment. Okay, how do we diagnose? It is based upon basically by the investigation and clinical symptoms. Clinical symptoms, I already mentioned. The investigation wise, we see CBC wise, most of the time the counts are normal and lymphocyte predominant. CRP can be high in adenovirus, and we confirm the diagnosis by doing PCR, nasal and throat swab. Okay, what is the treatment? Most of the time the symptomatic treatment like giving paracetamol, giving some anti-cold medicine. If there is vomiting and diarrhea, we give diarrhea medicine, and for eye infection we give antibiotic eye drops. Generally we avoid giving antibiotic in case of adenovirus infection. So how to prevent this? And whenever there is symptoms, consult your nearby pediatrician, take appropriate treatment. The prevention is like COVID prevention. Avoid gathering, avoid attending functions, and usually whenever there is cold and cough, avoid sending kids to the school. And whenever there is cough, let them use their sleeves to cough or use mask, and frequent hand wash, and avoid touching your nose and mouth. And what about vaccine? Vaccine currently not available in India, but in US it is available. That is only for military persons. The current recommendation is immediately consult your doctor, take appropriate treatment. No need to be panic. Most of the time they get recovered. But in West Bengal we are